Activity, changing a diaper. Deficit given, right upper extremity, paralysis. Equipment needed for project. Doll, changing surface, diapers, and wipes. Key challenges to identify. Preparation needed for activity, body positioning, joint mobility and stability, navigation of the body to adapt due to lack of mobility of right arm, and length of time needed to complete activity.
I'm Julie, and this is Antonia, and today we are going to demonstrate changing a baby with a right arm paralysis. So Antonia is right arm dominant, and she has a paralysis, and she's going to change the baby with one arm. So first, she's going to place the baby down on the changing table, very carefully, supporting the head. She has all her supplies laid out, which is crucial when changing a baby with any type of dysfunction or challenge that you may face. She's going to remove the clothing. And then she's going to secure the baby down to the changing table with a strap. These are all, most changing tables come with these straps. They're very needed because babies tend to squirm. She just placed her right arm on the baby as a weight to keep the baby still, and it's also going to help her. If you notice, Antonia needs a good amount of arm flexion and shoulder flexion to be able to attain the skill. She actually needs more manual dexterity with only using one arm. She needs muscle power, increased muscle tone, muscular endurance, and she also needs to control her involuntary movements such as posture. Now she's wiping the baby, so she's cleaning the baby front to back, which is very important. There's a good amount of strength and energy required. So next she's doing the box area. And usually takes about 2 wipes. Now she's going to move the diaper into place and work her fingers to get the tabs in place. Doing this requires a good amount of pressure sensitivity. She needs to be firm, but also gentle with the infant. Now, if there was an irritation with the baby, she would apply a cream such as Bomex, but today this infant does not have a diaper rash. And now she is applying the clothes back to the infant. So to determine that the baby needed a diaper change, Antonia might use hearing, such as the baby crying, to alert her that it needs a diaper change. And also smell. If the baby has a soiled diaper, she could smell that it needs a diaper change. So we have to use our senses a little bit more. And she's very patient. Also, this requires sequencing and cognitive ability to be able to do all these tasks, and perhaps a little bit more cognitive ability to think how you're going to make the accommodations to get the baby changed. Her shoulder is also using more internal and external rotation to be able to position her arm in the right spot. And she's using at about 60 to 70 degrees of shoulder flexion. This activity also requires joint stability of her shoulder. Honestly, with a right arm paralysis, it could take a little bit longer to do the task of changing a diaper than normal.
Next, you will see changing a diaper with full function. Differences to take note of. Time commitment needed, amount of energy needed to complete activity, flow of completing activity, fine motor skills needed, amount of flexibility and dexterity needed, body positions and coordination needed between body parts, and range of movement needed.
Hi, I'm Dorothy. This is Candace. Candace is going to show you how a fully functional individual changes a baby's diaper. You will notice a difference in performance skills when placing the baby down on the table. She doesn't require as much range of motion in her shoulders. You will also notice a difference in time requirement that it takes for changing the baby's diaper, including taking the pants off or whatever the baby's wearing. Changing the baby requires less effort and less dexterity than an individual with a dysfunction. Overall, the activity requires less endurance, muscle strength, skill, and fine motor, energy, attention, and problem solving.